So we get home, and my husband is like, we really need to go to the hospital. And I tell him, I don't want to go to the hospital this early because I'm still not feeling, me, I'm expecting pain. Yeah, based off the stories that I've heard about labor pain. So I'm expecting that pain. I'm telling her, babe, I'm still not feeling that pain that people are talking about. So let's give it time. And so I told him, since I have an app that I was using during my pregnancy, and it has a contraction timer. Let me time and we see if this is real contractions, if these are real contractions. And I was like, okay, so this is the app. I'm so grateful. I still have it. I never deleted. So this is the app. It's called Baby Center. That's the app. And then this is the contraction timer. So when I click on that, it still has my contractions. I don't know if you can see. It still has my contractions there until the time we decided, okay, we need to go to the hospital. So this was at 6. This was at 6 p.m. That's when we got home. So I told her, let's first see if these are real contractions. And so I started timing them. And the first contraction lasted 43 seconds. And it was like for 6 minutes apart. And then the next one came 8 minutes after, and it lasted 58 seconds. So by the time we were getting to like 8, my contractions had been like between, on average, like 20 seconds long. Some will go even 40 seconds, and they're like 5 minutes, 4 minutes, 6 minutes apart. So I googled quickly how long should contractions be, or how do you know you're in labor. Contractions help push your baby out. When you're in true labor, your contractions last between 30 to 70 seconds and come about 5 to 10 minutes apart. So when I read that, now I panicked for real, because I was like, this is exactly what we're experiencing. And so I called my Uber guy and I tell him, hey, I know we had planned for tomorrow, but I think the baby is here. And he's like, oh my God, I'm not around. I've gone for, I don't know where he had gone to, like, I think a burial or something. I was like, oh God. So now what? And I'm in labor. I don't want to like just call any Uber guy. So it's like, let me send you a friend of mine. I was like, okay, tell him to hurry, please. This time it's like 8 p.m. Sunday, yeah? So I call my doctor real quick and I tell him, hey, I think, the baby is coming. All the things they told me to watch out for are here. And he's like, okay, just go to the hospital and tell them, Dr. Mtu was the one who was attending to you and stuff like that. I was like, okay. But let me know when you get to the hospital and let me know how things are progressing. So, long story short, the Uber guy came. I'd already packed my hospital bag like a month ago, so it was already just picking, and we were about to leave the house. Just before we left the house, I told her, okay, just take me a picture of, the last moments of the baby bump. So this is the picture. I was so fat. Yes, I'm calling myself fat. Yeah, so the Uber guy comes and we get to the hospital. So let me just say this, and this is from my own experience. I thank God that contractions don't last like for a long period of time. I thank God contractions come like maximum 20 seconds, 40 seconds, and the pain is gone, and you're okay again for like a minute or 2 or 3 minutes or 4 minutes, depending on which stage you are which stage of labor you're at. So that is, for me, I found that was grace, because that pain is crazy, but it only comes for like 20 seconds, maximum 70 seconds, and it's gone. So that, for me, I found, I really thanked God for that. Just trying to look for all the positive things in this case. So I thank God for that particular aspect, that contractions don't last like the entire time. They just come, they let you breathe, they come again, they let you breathe, and all that. So we get to the hospital like at around 9. So nurse goes, gets her equipment, she tells me to change and all that. I lay down for checkup. Woo! Nobody prepares you for that. Hmm. Hmm. Kudos and shout out to nurses, by the way. Oh my God. Kudos and shout out to nurses, doctors, health workers. You guys, hands up. I cannot do the work that you guys do, but you're graced for it, and we thank God for you. So the nurse comes with all her equipment. I'm all ready. She tells me to lie down. I do. Nurse digging. Nurse digs in with her hands, with her fingers into my VJ to see how far or how much dilated I am. Yee! I remember her hands coming out, and she's like, "You're around 3 to 4 centimeters dilated." I'm like, "What?" She's like, "Yeah." So does that mean I'm in labor? It's like, "Yes, mommy, you are in labor. The baby is about to come." I was like, "Okay, all right." So we begin the admission process. I have to fill in papers, still in my pain. Hubby's taking care of like the insurances and payments. And I had to do a COVID test because it's Corona time. They cannot admit a patient without having a test. So the nurse comes back with the COVID stuff, and to be really honest, that was not even the most painful thing. And then at this point, I'm encouraging and motivating myself. Like I'm telling myself, nothing is going to be as painful as giving birth. So whatever else you want to give me, bring it. Like nothing will be as painful. I fear needles. I fear whatever. And then from the stories of, the COVID testing, I'm like, I just had to motivate and encourage myself. I told myself, there's nothing that can be too painful as the process of giving birth. So bring everything you have to bring. I'm ready. So she came, did whatever, and that was not even painful. To be honest, she was very gentle. That was the easiest part of that whole process. So we finish everything, and I get to my room. And I did not vlog. I did not vlog or record or take pictures or anything because at that point I not started my YouTube channel. So yeah, just create the picture in your head. So we get into the room. It was a nice cozy room, very, very decent. And so my husband got into the room with me, and I asked them if he can stay, and they're like, yeah, he's your partner, he can stay. So we stay, and I'm telling them I'm very hungry, I want food. Remember, it's now like at around 9:30 after I've done the admission process, and they're like, okay, so we'll just tell the kitchen they'll prepare food. Kumba, it's 9:30. Hospitals, people eat early. Me, they have to cook for me afresh. They have to cook like afresh. They have to cook a meal for me. And I did not know that. I thought like there was food they'll just go pick and bring for me. Oh, they've already confiscated our snacks because we packed like a lot of snacks. I can't have those snacks. We've left them at the gate. I'm hungry and they're cooking. I remember I kept going to the door to check whoever I see passing. I'm like, my food is not ready. And eventually the food came like after 40 minutes. That was the longest time ever. So at this point, I'm in my gown. We're just there. We call everybody. I call my mom. We call my mother-in-law. We just tell them what's going on, and we're in the hospital. And yeah, everybody starts praying. So I remember there was, because the bed was really high and I'm short. So there's like a small, let me call it a stand that they put at the bed that you can step on so you get to the bed like easily, yeah. And so I took that thing and I put it in front of me because I was seated. There was a chair, so I was seated on a chair. I did not want to lay down. I did not want to sit on the bed. Like I was just feeling uncomfortable. I needed somewhere I could just lean back. And so that little stand was helping because I'll put my leg there. I'll hold the seat and I'll I'll just exert pressure, or I don't know what I was doing, but that is what helped me cope with the pain. So every time the contraction will come, to go away, I'll be fine. And at this point now, contractions are now like 3 minutes apart, 2 minutes apart. Yeah, it's getting crazy. My mucus plug is still coming out. My threshold for pain is very low. My threshold for pain is very, very low. So I've done my research, and like on all the ways that you can use to cope with the the labor pains, and I'd settled on epidural. The next time she comes to check me, I was 5 centimeters dilated. That insertion of fingers into somebody's VJ, by the way, is so uncomfortable. Anyway, so by the time she was checking me the next time, I was 5 centimeters, and I told her I'm in so much pain, like I cannot stand. Like, she was looking at me. I don't know if it's because I'm tiny, so she would look at me and she'd be like, "Whoa, yeah." So she asked me, "Do you need pain medication?" And I told her, "Yes." "Do you have anything you can give me? I need it. Give me." And she's like, "Yeah, we have some pain medication. Let me bring it for you." So she brought some pain medication. I don't know the names of this medication, but I'll just explain them to you. She gave me 2 injections. Yeah, she gave me one right here, and then she gave me an injection on my lap. So I asked her, is that gonna help me? And she's like, "Yeah, this one will help you manage the pain. It won't take away the pain, but it will help you manage through the pain." And then she told me to, of course, breathe and all that. So, but she gave me a heads up. It's gonna make me feel like I'm drunk, like I'm very high. In like 5 minutes, my husband was just trying to gist with me, just trying to encourage me, talk to me, give me some stories to distract me from the pain. And I remember in 5 minutes I was seeing him double. I was seeing him double, I was seeing him in twos. Yeah, and I was already so high. It also helped me with the pain. Manage it. And so I was even able to sleep. So I got into the bed and I slept. I remember they came to wake me up at I think around 4, just to see how I'm progressing. 5. They came in 5, at 5, just to see how I'm progressing. And when she checked me, I was at 6 centimeters dilated. And I was like, okay, where is the anesthetologist? Where is he? I need an epidural. You guys remember, I want an epidural. And the doctor is like, yeah, we remember. And he's coming, he's on the way. We waited for the guy. The guy came, I think, at around 6 a.m. So 6 a.m., I'm at 6 centimeters. The guy comes, and the minute he gets into the room, he says, "Okay, my name is Dr. Karanja. I'll be your anesthetologist. I need you to sign these papers," and stuff like that. So he's explaining to me the dangers of epidural, and I'm like, "Dude, just give me that thing. I've already read everything. I'm ready to take the risk." So after I signed the papers, he asked me, "How did you know about epidural?" And I told him, well, first of all, it was recommended to me by my mother-in-law. And then I've also watched a lot of videos on YouTube. And he's like, okay, that's good, because most Kenyans or most women don't know about it in Kenya. And, we're happy with the uptake. Like slowly, women are getting to learn about it. And it's helping so many of them cope with pain, cope with like the labor pain. I was like, okay, that's nice. So all this time the pain is coming, and yeah, so I was told that epidural is painful, but from the research that I've done, there are those that have said they felt the pain, there are those that say they did not feel the pain. So I wanted to experience it myself. So the doctor said, I know you're having contractions, and they're like 2 minutes or a minute apart. So every time a contraction comes, just let me know. So we stop. I stop the process, and then we continue when the contraction goes. And like, okay. So my husband was asked to stand in front of me, and then I was told to hug him. Yeah. So I hugged him, and then the doctor told me I just need to stay in a curved way, so that like my back is sort of curved. I was like, okay. So I did that. Contraction will come. I'll be like, wait, it's coming. It will go away. Something that I found so uncomfortable was having students in my room. By the way, doctors, that thing is not interesting. I know I was not in the right senses or in my right mind to complain. But that is not cool. I had like 3 students in my room, and one of them was male. Not that I cared, but 3 students just watching I think they were on practice or something. Yeah, you need to stop that. Let people consent to having students in the room. Please. Yeah, so I remember he would explain every single thing he was doing. So the first thing, he disinfects my that area that he's gonna inject, and then he gives me a numbing medication. So that is the only injection that I felt. Of course, it's a needle. So that's the only needle that I felt getting into, like pricking me. So it's just a prick. It got in. And then the numbing. So by the time that medicine is getting to your system, it's like instant. So instantly I felt the numbing. And so after that, he took now the tube that was gonna administer the epidural into my body, and so he put in the tube through the needle, and then he would, secure the tube and then pull the needle out. So you're left with the tube only. Yeah, and that tube is the one that is getting the medicine into your system. So that's what happened, and I think in like 3 minutes he was done. The least painful experience in my birth story, the least painful experience, like it was just easy. He was done in 3 minutes. And so he started telling me I'll start feeling the effects of the epidural in like 5 minutes or so. So yeah, for sure in 5 minutes I was a different person. I could smile, I could now talk. I even looked at my husband. I was like, "Hi, you're here." Like it was a 360 change or shift. It was instant, and I loved it. I thanked God for it. Like, I thank God for technology. If you have a fridge in your house and you have microwave and all that, I think it's good to embrace technology even in these areas of medicine and stuff like that. So I thanked God at that moment for epidural. The anesthestel, that one could not leave the room. He couldn't leave the room because he had to monitor the medication, how it's affecting me and all that. So by the way, you can feel the epidural medicine getting into your system because it's cold. Like it's sort of, it has a cold effect to it. Like you feel some cold, some cold sensation, some cold sensation. So yeah, I was feeling the medicine going through, like, yeah, that it was a nice feeling though. Yeah, and so we started chatting. So at this point, the anesthesiologist tells the nurse, I think you need to check this girl because her contractions are now very close. So the nurse checks me and I'm 8 centimeters dilated. At this point, by the time she's checking me, or before the epidural, my water had to be broken. They had to break my water, and that was so uncomfortable. It's so painful. Like, not painful, but it's just the worst thing on earth. I don't know. Yeah, so they had to break my water, and then I received the epidural after. So when the nurse checked me after the epidural, I was 8 centimeters dilated. And so the nurse tells me, at this point now, remember, I'm not feeling pain. Like, my contractions are coming, yes, I can feel them. You feel pressure, but there's no pain. Like, there was no pain. I did not feel any pain. I was just feeling the contractions, like pressure. I was feeling like, yes, I'm feeling there's something that's going on, but it doesn't have the pain with it. Because remember, I've experienced pain, but now here I am, I'm just feeling pressure, but no pain. And so the nurse tells me, you're now at 8 centimeters. So we'll leave you to, dilate fully. Remember, the dilation, the goal is 10 centimeters. So we'll leave you to dilate fully. And in case you feel anything and all that, just ring the bell. I was like, okay. So I'm feeling so uncomfortable. But at this point, because I have the epidural, her inserting her fingers in my vg is not as uncomfortable anymore. But still, I don't want that encounter. So I would feel pressure, I would feel something is going on, but then I don't want to call the nurse, I don't want to ring the bell because I don't want her to come and insert her fingers in me. Like, I felt that was so intrusive of my privacy. Comment, women, comment. So I remember after 5 minutes, I couldn't take it anymore. I rang the bell and I told my husband, I am not feeling. I rang the bell. So when I rang the bell, the nurse came quickly and she was like, okay, let's check how far you are. Oh, The nurse lifted up my gown like this and was like, I can see the head. Like, you can't even walk to the delivery room. We'll just wheel you. Yeah, wheel. Not on a wheelchair, but with the bed. So they dragged me with the bed that I was laying on into the delivery room. And so I get there and I have to move from that bed to the delivery bed. Hey, that was the hardest. That was like the hardest part, because remember I have an epidural injection, and so that, what it does, it numbs you from your navel downwards. So I can't feel my leg. I can't. It's crazy. Like, yeah, but we managed to do it. And at this point, I think it's 9 a.m. in the morning. Yes, 9 a.m. in the morning. So we got to the room, the doctors came, and I was told, Marion, we can see the head. It's time for you to push. Again, those students were in the room. And their teacher was just right in front of my vagina. And she kept, you know, her hand, you know how teachers are. Actually, no offense to teachers, but her hands, I don't know if it's her teacher or their trainer, whoever they are in those medical school. So her hands were right at the back. She was so calm, and she kept saying, I can see the head. I can see the head. Just push the baby. And so, thank God there was this nurse. I can't remember her name, but she was so good. And every time, like, I was feeling something, she'd be like, okay, Marion, there's a contraction, push. And she'd be like, push, push, push. She'll just play around with my belly. Oh, that nurse really helped me. Bless your soul, wherever you are. I can't remember your name, but God bless you. So she'll, like, after 2 minutes, the contraction will go away, and it'll come back. Yeah, here's another contraction, Marion, push, push. And then at some point, I think there was no enough room, and so she had to perform an episiotomy on me. An episiotomy is a cut that is given on your VJ area, like either on the side, some can go down, or this other side. Yeah, so she had to perform an episiotomy so that my baby's head can pass through my birth canal. And so at this point, my husband is also there. He's like, babe, you can do it. I can see his head. I can see his hair. He has so much hair. So that is encouraging you. We got into the labor ward at 9, and all this is happening. At 9:15, my son was born. So by the time the head is out, like, I felt you'll think it's like a ball that has slipped out of you. Remember, the cord was around his neck, and so the minute his head was out, the nurse just removed the cord around his neck, and I was able to push out, then the rest part of him. And I've always been curious. Okay, I know this is so gross, but I was always curious. And I remember even us discussing with my husband, how does a placenta look like, And so when the minute the baby was out, I told the nurse, please, I want to see the placenta. Like, I want to see it. And the nurse was like, okay, sawa. So when I bathed out the placenta, it was put in a plate, sort of like a silver plate. And I was shown, and I was looking at it, and I was telling my husband, see, I told you it looks like a liver. And yeah, so that was a good experience. So my baby was taken to, whatever they're taken to, sort of get him cleaned. At this point, he's not crying because I think he was in distress because of the cord and, us pushing. So he didn't cry for like a minute or two when they were trying to get him to cry. And immediately after that, I just remember hearing him doing Mwah, and that was it. He only cried. Like, that was the only cry he made. Like, that's the only sound he made. And it was so touching. It was so awesome. So since I had an episiotomy, the doctor had to stitch me up. Yeah, I still have the epidural, so I'm not feeling pain, but I can feel there's something that's going in and coming out. Like, that's an needle or whatever they use to stitch you up. And the thread, you can feel the thread being pulled, but it's not painful. Like, you can feel everything going on, but it's not painful. So she had to stitch me up. And I remember us talking, because at this point, after my baby is born, I look at the doctor who's helping me deliver, and I notice she's pregnant. I'm like, oh, you're also coming to this you're also coming to this journey soon. And she's like, yeah. So I ask her, how far along are you? She's like 7 months. And I'm like, you're not scared of like helping mothers deliver and you're pregnant yourself? She's like, no, but because of you, I've seen your experience with the epidural. I'm gonna have the epidural. Like, I'm gonna go with the epidural also. I'm like, yeah, that was such a saver. So I started thanking the doctor who was giving me the epidural anesthesiologist. I think his name was Karanja or something. Wherever you are, God bless you. You did an awesome job. You gave me the best. You gave me the best medicine. You didn't make any mistake. Like, I'm so perfect right now. Even after the labor, I'm okay. Like, God bless you. So remember, you guys, me and my husband earlier on, we were saying, oh, it's not 31st May is not a good day for someone to celebrate their birthday. You remember that story? Who is God? God is not from my village. My son was born 31st of May at 9:15 a.m. Like, God made sure it's in the morning so that there's no confusion. Not like it was 12 a.m. or 11:59 p.m. of the previous 9:15 a.m. So yeah, the day that I thought was a weird day for someone to celebrate their birthday is my son's birthday. Oh my god. Yeah, so I just love how sometimes God just surprises you. Like, in his mind, I'm thinking he's like, you just plan. He's just laughing like, you just plan. You don't know what I have in store for you. Yeah, so that's what happened. I remember after birth, I called everybody who was praying for me, just to tell them good news. I called my mom, called my mother-in-law, just tell them the baby is here, and it was just perfect. The next day, we were discharged, all healthy, mother and baby, and we went home. And it has been an amazing journey watching my son grow. Now we are 6 months. I just love everything about him. He's just so perfect. This was the picture that was taken like an hour after he was born with his daddy. I had a vaginal birth with an epidural. Thank God for epidural. It's such a lifesaver. Thank God. If you can, please read about it. If you want to try it out, read about it. It's for people who fear pain and don't want to go the CS way. This is like the next option. All right, so let me know your birth story. Let me know your horror stories. I can personally say, by the way, my birth, my labor and birth was not horrific. Like, I don't have those horror stories, mostly because of the epidural. Because by the time my pain was supposed to intensify to that place when I go mad or I go crazy, like at 6 centimeters and beyond, I had the epidural injection. So that is what really helped me to cope. So I'll see you in my next video. Don't forget to subscribe, comment, like, share, and always remember to be kind to one another, love one another, and treasure every minute you spend with those that you love or those around you, because tomorrow is never promised. Bye bye.